This is Anna Levodnaya, a pediatrician and candidate of medical sciences, and we will discuss an important summer topic, diver's injury. It occurs when diving headfirst into shallow water where the depth and bottom terrain are unknown. This is important for everyone to know.
Maybe I will never dive headfirst, but only enter feet first. I wish the same for everyone, so they don't make the same mistakes I did.
Due to the impact with the bottom, rocks or logs, dislocation or fracture of the cervical vertebrae occurs, along with bending, compression, and rotation of the spine. This leads to spinal cord damage and is accompanied by impaired movement and sensation below the neck. This is a very dangerous condition. The damage will vary from weakness to complete loss of function in the legs, arms, torso, and pelvis. The prognosis can range from disability to even death. Children are more susceptible to neck injuries, their muscles and ligaments are weaker, their joints are immature, and so on. How can you suspect spinal damage after diving? It is important to pay attention to a child's complaints about their neck, such as neck pain, muscle spasms, inability or limited movement of the head and neck. Next, pay attention to neurological symptoms, such as muscle weakness, paralysis in the arms and legs, numbness, sensory disturbances, or tingling in the arms and legs, even if they did not occur immediately after the injury. Additionally, the fact that a child is walking does not rule out a spinal injury. Some children are initially asymptomatic, so it is important to see a doctor in any case after a diver's injury if there was an impact with the bottom. If you suspect a neck injury, you need to take the child out of the water, lay them on their back on a flat surface, and call an ambulance. It is important not to move the child, not to move the neck or head, and not to attempt any adjustments yourself. Monitor the breathing and the position of the chin. If there is no breathing, it is necessary to start cardiopulmonary resuscitation, CPR. The child needs to be urgently taken to the hospital, where an X-ray, CT scan, or MRI will be performed, and a consultation with a surgeon will be conducted to decide on the necessity of surgery. Treatment depends on the severity. Surgery will help to return the bones to the correct position and secure them. Sometimes conservative treatment is recommended. This involves wearing a halo vest or a collar to stabilize and protect the neck. You have probably seen these in movies. Pain relievers, various physiotherapy methods, and so on are also recommended. Treatment can take months depending on the severity of the fracture. Children recover faster than adults. A diet with sufficient calcium, vitamin D, and protein is recommended. What is important to discuss with children when you go to the sea or a lake to prevent diver's injury? First, do not dive where the depth and the bottom terrain are unknown. Especially do not dive headfirst. Second, swim only under adult supervision, and preferably with trusted adults and in trusted locations. Do not dive into the water after or during a storm, as the bottom terrain may change. These are 3 important points you should tell children. Share this video. It is important to know. Thank you for watching me. Stay on my channel. Subscribe. I have a lot of important information about children's health for parents. Every parent should know this.